This case is an example of decreased fetal movements. A 30-year-old woman at 32 weeks gestation reports reduced fetal movements for the past 2 hours. She has no pain or bleeding. What is the most appropriate next step? The most appropriate next step for assessment of decreased fetal movement is auscultation of the fetal heart rate, is assessment of the fetal heart activity. Assessment of the fetal heart activity. This is an example.
Hello. Let's listen fetal heart sounds using Doppler. First, ask the mother to lie on her back or left side. Now apply generous amount of gel to mother's abdomen, which helps by improving sound conduction. Now, place Doppler probe at the lower part of the abdomen and gradually move over abdomen to locate fetal heartbeat. Once you find fetal heartbeat, listen to heartbeat.
So this is an example of assessment of the fetal heart activity as the first line of assessment of decreased fetal movement. So when a patient complains of decreased fetal movement, the first next step is to assess the fetal heart activity, to assess the fetal heart rate. Next step, if the fetal heart rate is abnormal, then CTG should be performed. So, auscultation of the fetal heart rate followed by CTG if the fetal heart rate is abnormal. This is an example of the CTG.
Abdominal wall, which indirectly gives an indication of intrauterine pressure. The mother will also be holding a pressing button to indicate whenever she feels fetal movements. These are all connected to the CTG monitor, producing a graphic representation in the form of a CTG. The monitor displays the fetal heart rate over here and the tachometry measurement here. CTG monitors can also measure the maternal parameters, including blood pressure and maternal heart rate. Great. So, some CTG basics. So, here we've got the graph paper CTGs are printed on. The top trace is the fetal heart trace. The tachometry trace is displayed below. These marks are markers of fetal movements, which are indicated by the mother as she presses the pressing button. On the graph paper represent.
So this is the fetal heart trace, and these are the fetal movements, and here the tachometry. Okay, this is the CTG. The CTG can assess the fetal well-being, by assessing the fetal heart rate, the fetal movement, and the uterine contraction. Okay? So the first step was auscultation of the fetal heart rate. Then assessment of the fetal well-being by the CTG. Initial assessment of decreased fetal movement includes confirming the fetal heart activity, auscultation of the fetal heart activity, followed by CTG to assess the fetal well-being. And if the CTG was abnormal, then ultrasound should be performed if the CTG is abnormal. Again, initial assessment of decreased fetal movement. Number one, confirming the fetal heart rate or the fetal heart activity. If the fetal heart activity is abnormal, number two, CTG should be performed to assess the fetal well-being. If CTG is abnormal, Then number 3, ultrasound should be performed. So immediate ultrasound is not the first line. Immediate ultrasound is not the first line to assess the decreased fetal movement. Reassurance is unsafe. If there is a complaint, decreased fetal movement, cesarean or induction is premature without fetal compromise. Induction at this age will give a premature. Neonate will be premature. I will show you now the importance of ultrasound if the fetal well-being or if the CTG is abnormal. This is a 27-year-old gravid woman with a history of a second trimester spontaneous abortion. So this patient has a previous history of spontaneous abortion, and now this pregnancy showing ultrasound, sagittal image of the uterus and the cervix. This is the area of the cervix, revealing that the cervix is dilated up to 3 centimeters. Can you see the cervix here? This is the cervical canal, is dilated up to 3 centimeters with classic hourglass. This is the classic hourglass. Classic hourglass. Dilatation of the cervix. Also, bulging membranes protruding into the vagina. Okay, so bulging membranes is seen protruding through the dilated cervix into the vagina. The fetal foot is seen on the transverse image of the cervix. Can you see the fetal foot here? This is the fetal foot, and these are the toes. So the fetal foot can be seen here on the transverse image of the cervix, as well as the dilated cervix is also seen here. The diagnosis is cervical incompetence. Cervical incompetence is the reason of the recurrent abortion. She had a previous abortion, and now the cervix is dilated again, and the membranes are protruding into the vagina. Now, this is how color Doppler and pulsed Doppler ultrasound is important to assess the fetal heart rate.
How to measure fetal heart rate.
By ultrasound.
First, focus on the fetal heart. Then, activate the M mode. The fetal heart should be positioned to the sonographic marker and the heartbeat waves are visualized on the screen. Freeze the image. The distance between the peaks can be marked, and the machine counts the heart rate which is displayed directly on the screen.